Hello, welcome to NurseWorks in association with Tropical Pine Tree. Hi, this is Kathy. It's a beautiful evening here in Orlando, and this evening I'm going to be talking about direct and indirect care and also some about staffing. Before I get any farther, I do want to give you a brief description of direct versus indirect care because it will come into play in the numbers that I will give to you. Direct care is that time that the nurse or the CNA spends directly with you in your presence, giving you medicine, feeding you, dressing you, changing your dressings, looking at your IV, anything that they're in the room actually doing something with you. Indirect care is the time that they spend away from you, but they're still doing your care. Whereas maybe they're doing charting, they're calling the doctor, they're talking to your family, they're cleaning up the cart, they're getting things ready for your next thing that you're going to have. So indirect care and direct care are completely opposite. So when I talk about dividing your indirect and direct care, it's because those two things encompass all the care that you're going to receive while you're in the facility. But I want you to know that the ratio between direct care and indirect care are about equal. So if a nurse spends 3 minutes with you in direct care, she will also spend 3 minutes away from you in indirect care. Wow, that was a lot of stuff. Let's take a little bit of a break here before I get into the nitty-gritty of staffing. Well, I guess that was enough time. I went to a website, a government site, and that would be Medicare.gov Nursing Home Compare. I've used this site on and off through the last couple of years as I was looking at things, and I find it's a very good site. However, it is incomplete in the information you will need to know when you decide which place you want to go, because it doesn't give you the full insight on staffing. Now, I picked out a nursing home. I blocked out the name. It's kind of a mid-range nursing home, believe it or not. And the one thing I wanted to point out to you is this red arrow where I pointed it. You can see that the nursing home health inspection rating is much below average. In fact, they got 1 star. Their staffing rating is 3 stars, or average, and their quality of resident care rating is a total of 5 stars, much above. Now, there's something fishy about that. You can't have much above average resident care if you have failed your health inspection. Those two things just don't make sense, and that's why I say you need to take the things that you see with a grain of salt and do some thinking before you make up your mind. Don't just take one source as the end-all. So I'm going to the staffing area here. The one thing that I have in red around there is the hours of nursing care per resident per day. You might be wondering how this all breaks down and how much time you'll really get. This is what the government says according to this nursing home. You'll get 34 minutes of RN care and 48 minutes LPN care and 2 hours and 48 minutes of CNA care. I bet that sounds pretty good. But you have to take those minutes and divide them by 3 for each shift. And you'll see an RN will be giving you 11.3 minutes, an LPN 16 minutes, and a CNA 56 minutes. Well, that's quite a bit lower, but we still need to do something else. And this is something that a lot of people don't even think about, and that is dividing between direct and indirect care. And it's generally on a 50-50% ratio. Some more, some less in different facilities. Once you divide it again, now you'll be receiving from your RN 5.65 minutes a shift. LPN, you'll be getting 8 minutes, and the CNA 28 minutes. Well, that's not really optimal, you think, but we're not done yet dividing and coming up with different answers, because time isn't given out equally in a nursing home to its patients. Nursing homes like to bring in high-need patients because it gives them more money from the federal government. So it's more bang for their buck. So let's decide what could go wrong. You have 57 patients. Well, what if 20 of those patients had just one IV, one trach, one feeding tube, or one in-house dialysis. I'm meaning one per patient. And that is a very low number. Usually if you have a trach, you have a feeding tube, or you have dialysis, you have an IV. Usually it's a combination. And so for each machine, you can consider 30 minutes more time of nursing care per shift. What we're going to do, make this a little more real. With 20 patients, each with one machine, you'll need 30 minutes extra each shift, or 1,800 minutes. Adding in one one-to-one patient would equal 1,440 minutes. This is a total for 3,240 minutes, and those minutes will come from the remaining 37 patients. The remainder needs to be divided up between direct and indirect care. The remaining time must be split between the remaining 37 patients. Let's do the math. The amount of time originally earmarked for 37 patients is 6,586 minutes. So subtracting the original 3,240 minutes, you will get the remaining will be 3,346 minutes left for 37 patients. So now you're going to divide that 3,240 minutes by the 37 patients and then by 3 shifts, and you'll get a total of 30 minutes per shift of combined RN, LPN, and CNA care. Next, you'll divide that number by 50% to account for direct versus indirect care, and you'll get a total of 10 minutes combined by RN, LPN, and CNA care per shift. What does that equal out to? RN less than a minute, LPN 2.5 minutes, and CNA 5 minutes. That's minimum standards at its best. So why are nursing facilities so proud to announce that they always meet minimum standards? And you should know that staff are given no choice but to buck up and do this. They're trying the best they can do under these circumstances. Our government gives nursing homes minimum staffing standards that they have to meet. The minimum requirements the government sets for things are very low. It should come as no surprise that staffing requirements by our government are low as well. There are other things the government gives minimum standards on, such as wage. You can make a living according to the government, $7.25 an hour. And those numbers are the very minimum the government decides that a person can exist. I would call it subsist in life. But yet at nursing homes, we're proud to tell you we meet minimum standards. Minimum staffing hours are just that, bare minimum, needed for survival. So what is direct care? This is the time that your nurse or CNA are going to be spending with you. And these are things that will be done. Taking vital signs, taking your weight, doing activities of daily living such as brushing teeth and toileting, changing the bed only is when the patient is in it, dressing a resident, feeding a resident, assisting with mobility, emergency aid and life support, doing EKGs or CPR, calculating calorie count, range of motion, reposition and turning, transferring and giving medicine. Also setting up of equipment in your room, feeding tube setup, maintenance, and also the feedings and flushes. Is assistance with incentive spirometer, coughing and deep breathing, oral suction, set up chest tubes, obtaining supplies for sterile procedures and opening them while they're in your room, IV care, post-mortem care. That's a lot of care for nurses to cram into just a couple minutes. Then after all of that, they have to move on to indirect care, which takes about another 50% of their time. What's indirect care? Cleaning the equipment, room care, taking specimens to the lab, phone calls to the doctor, to the family, to other facilities, assembly of orders, scheduling appointments, stocking supplies, cleaning nursing areas, cleaning the patient after a procedure is complete. Even though they're doing direct care, it's considered indirect care here. Supplying cards, obtaining and delivering blood products, labeling and checking lab specimens, transcribing orders, scheduling tests and procedures, ordering supplies, orientating and supervising ancillary staff, keeping a logbook up to date, and updating the information systems. I hope you found this very informative and interesting. I will be talking about staffing and patient care numbers several times to come because there's so much to be said and so many things going on. So stay tuned, and I will get back to you next week with a new episode. Thank you.
Thank you for watching. If you found our video helpful, please pass it along to somebody else. And be sure to like us and subscribe. You can support us through Patreon. Look at our cool rewards.